Hello, and welcome to Wellness Wednesday with 3W. Wellness Wednesday is sponsored by 3W Medical for Women, a nonprofit medical clinic offering free of charge or low-cost reproductive health services to women in the Seattle area, regardless of income or insurance status. 3W does not profit off of the reproductive health choices women make. The information shared in this podcast is the opinion of the speaker or speakers. Medical information is not intended as individual medical consultation, but for general education only. Always consult your own health professional for personalized advice regarding medical decisions. And if you're in the Seattle area, consider making an appointment to consult with us. I'm Helen Nguyen, CEO and co-founder of 3W Medical for Women and the host of today's podcast. Hi there, Wellness Wednesday listeners. Thank you for joining me again today. We are in the studio with another wonderful guest speaker that I found on Instagram, Ginny, who I found on Instagram through, of course, my algorithm of looking up everything reproduction, everything women's health, everything fertility. Not to say that I'm obsessed with it, but it's kind of like our thing out here in 3W and out here in my own personal world. Welcome, Ginny, to our podcast.
Thank you so much. Good to know that my Instagram is working to get onto your algorithm. That's always nice to hear when you take the time to do these videos. You are just hoping it reaches people because I don't just shoot them for myself.
Yes, my algorithm is very interesting. It's like food, videos, and women's health. So those are the two things that I get the most of.
The same thing then.
Okay, Ginny, can you tell us a little bit about yourself? Where are you zooming into today?
I am in sunny Tampa, Florida.
Oh.
I know it's lovely, but it's actually like too hot for me right now.
Oh, really?
I am actually 15 weeks pregnant with my third. So it's just unbearable for pregnant me right now. Going out there, I just get more nauseous.
Oh.
But the fall and the winter, I'm obsessed.
Yes.
I grew up here, but we were in Ohio for a few years, and now we just moved back last year. And we have two little girls. They are obsessed with being outside. So it definitely was a great move for us. And I cannot, from a standpoint, being in the sun, being outside, wonderful for our health. But yeah, so more about my training.
Yes.
So I am a registered nurse, and people always say, Ginny, what do I call you? And I'm like, I don't know. I am a registered nurse with a master's degree in nutrition and functional medicine, and I am a certified fertility awareness instructor in the FEMM method. So people are like, are you a nutritionist? I'm like, legally, I just don't love that. But I am an expert in nutrition. I have a master's in nutrition, and that is where a lot of my private practice is. But of course, I'm also a certified fertility awareness instructor. And I have also a really unique background as a registered nurse. My nursing career started in reproductive endocrinology, I should say, in restorative reproductive endocrinology. That was really my background, was getting a deep dive into hormones. And so I have that just a really unique blended background of being, I don't want to say like I'm hormone expert, but I've been to a lot of trainings at this point.
Yeah.
I would say I am a hormone expert, and I'm also a nutrition expert, and I'm also an expert in cycle charting. So my private practice really aims to marry all three of those things together.
How did you land in this area? Like, was that something you wanted to do when you went into nursing?
Yeah. So when I'd always loved nutrition. I've loved nutrition since high school. And I originally did want to get my degree in nutrition, but I was told it was a useless degree. So to do nursing, people are like, you can't really do anything. Like, you have to then go get your master's to then become like a dietitian. In the school that I wanted, they didn't even have nutrition as a major. So I was just like, well, I guess I'll do nursing. If people told me I could do whatever I wanted with nursing. So I ended up getting my nursing degree. And in that journey, I actually was on the birth control pill, came off of it, was having 60, 100-day cycles, cystic acne, ended up really advocating for myself in the doctor's office, got diagnosed with PCOS myself. No one had any solution for me other than the birth control pill. I already tried that. And so I read Dr. Jolene Brighten's book, Beyond the Pill, and that really got me into the world of being obsessed with hormones plus nutrition, because I had already loved nutrition, and I have been on pretty much every single fad diet you can imagine, except carnivore. I haven't done that one, but every other fad diet I have pretty much done. But so that book just really was like, oh my gosh, now I love hormones. And I had a really unique opportunity when I was in nursing school. I was shadowing for one of my clinicals. It was like oh gosh, like the clinical, you could do whatever you want, like your choice. And so I ended up
Yeah.
shadowing a woman practitioner because I thought that I wanted to actually be a women's health nurse practitioner. And she got me connected with Anna Halpine, the CEO of FEMM, to do volunteer work for them. And then I ended up becoming obsessed with FEMM because I was like, oh my gosh, like you guys are the hormone people. And I was like, I need to be with the hormone people. And I actually like begged her for a job. And
Oh.
so I actually got hired with FEMM right out of nursing school. So it was a bit of luck, just the stars aligning and my passions like leading me to different areas. So that's how I got that opportunity.
Wow. There's so much we do not know. And it is such a shame that the medical community has really ignored the importance of hormones, talking about how it affects women's lives and women's seasons in their lives. Like there is such you enter into menopause and then that's it. There's like your fertile period and then your non-fertile period, and good luck dealing with
Yeah.
that. That's it. And
Yeah.
I'm just kind of like, wait a minute.
And yeah, it's like, we'll just, oh, you're having period problems.
Yep.
We'll put you on birth control. And then, okay, you can come off of birth control and then you have issues getting pregnant. Okay, well, we'll just go to IVF. And I just think, is there a better way? And if you see
Yes.
that on my website, that's like my tagline. I'm like, there's a better way.
Right.
That's just really where my research has just led me is why aren't we talking about these things? And that's what would always be when I was getting my master's degree. I'm like, I am writing these deep, like I've done research papers on endometriosis, on PCOS, and I'm like, there's research here on the impacts of our diet and lifestyle on these conditions. And yet, when you go to the doctor for these conditions, you are not even recommended to go to a nutritionist dietitian. It's just not mentioned at all. And
Yeah.
that's not informed consent. You don't
Yes.
have all the information to make an educated choice on what to do with your body. And that's
Yeah.
what really bugged me, if you could say that.
Yeah, no, I'm totally tracking with you about that because our listeners know my history of like infertility and PCOS and endometriosis and all of that stuff. And not once has nutrition been brought up in a doctor's appointment with me. Not once.
I just did an Instagram reel on like how insulin resistance, if you have insulin resistance, you do not have unexplained infertility. It is very clear in the research that insulin resistance or metabolic dysfunction contributes to infertility and recurrent miscarriage. And yet it is so cheap to test for.
Yeah.
Insulin is a $5 marker, or insurance could cover it if you have a provider running it. And yet it is one of the most underscreened things going on. And it is a lifestyle nutrition based issue. So I just think it's just such a disservice. And we do know that we've heard probably the statistics, it takes about 17 years for research to catch up to clinical practice. And I think that's just really what's happening right now.
Yeah. And all the people that are being misdiagnosed or dismissed or being told to go home and wait. When I was in the depths of the infertility journey, I've gone through 5 reproductive health clinicians, and not once was nutrition brought up as a solution.
That's just crazy.
Yeah.
That's mind blowing. It's
No.
mind blowing.
Yeah. And these are like experts, right? They run.
They're smart people.
Yes. And not once has nutrition been brought up as a possibility or a resource, but IVF was constantly shoved down my throat. So there's that.
Even if you move forward with IVF, we know that nutrition, diet, and lifestyle can improve those outcomes. You know, even if you have to move forward with that or choose that option, and I have it's my Instagram. I feel like my tagline now these days is like, nutrition is foundational to whatever you want to pursue on top of that. It is the base that you should build off everything else, right? Instead of also the conversation that I've seen of, oh, forget all these fertility doctors, like just do nutrition. And I'm like, maybe we should change that way of thinking. Again, that nutrition is the base of things, and that's what we want to build on top of. And whatever we're going to add to that, both just intervention wise.
I know you're in Tampa, Florida, and you run your own private practice. Can you see patients from all over the country right now through telehealth?
Yes, yes. So it's like consulting
Yeah.
is what I do. So our 4-month one-on-one program, I have other practitioners. I have 2 nurse practitioners on my team, a dietitian, a nutritional therapy practitioner, and myself. I started this 4 years ago now by myself. And in the past 2 years, I've now grown to have 4 more practitioners because we are growing so much because this is such a need. So yeah, so we work with clients all over the US and we do targeted lab work. I say the lab work that should be done in your doctor's office, but it's not. And then the only other functional, like fancy lab that we run is a GI map stool test. Is just because your gut plays such a role in your ability to digest your nutrients. And you need nutrients to make hormones to combat inflammation. Yep. So that's one of the big things it screens. Another thing is, I don't know if you've talked about the microbiome at all. Your
Mhm.
podcast, yeah, brought that up. But you have almost as many gut bugs in your colon as you do cells in your body,
Mm.
and they are a huge modulator of inflammation. They also make hormones like serotonin, or that's a neurotransmitter, and then they are also responsible for, I already said, modulating the immune system. It also can help with nutrient regulation as well. And then another big thing
Wow.
we've seen, which is crazy, when I first got into this, I was like gut infections, like parasites, that world's crazy. But I've actually looked at the research. So H. pylori has been a really, really big infection. And
Huh.
that's like very common known in medical practice. H. pylori is known to cause ulcers. That's pretty, and I think well understood by many GI doctors at least. But there is actually research coming out that it is associated with infertility and miscarriage. And so I've
Hmm.
now had several cases of unexplained infertility, and we address H. pylori and they get pregnant. And that's because infections in general, whether that be something like H. pylori, which is a bacterial infection, or something crazy like a parasite, those things, again, impact your inflammation, your ability to digest nutrients, and then can cause a lot of systemic issues and dysfunction. So it's an area that I thought was wooey, but I really, again, I've looked at the research and it is true. Like chronic iron deficiency anemia, infections. I had this one woman, she's like, my ferritin has been, which is your storage form of iron, has been like less than 10 her whole life. And ideally for fertility, you want it over like 50, 60. Lo and behold, she had 2 chronic GI infections. And she has gotten like iron
Wow.
transfusions and all that, and none of it would stick. And now her ferritin's 40 after, and it's staying there after addressing these gut infections and improving her gut health ways. So the gut is definitely a huge place we really focus on. That is not standard. So we do, yeah, a combination of blood work, GI map testing, and then we work to help to create personalized diet and lifestyle, supplements as needed strategies to address the underlying imbalances that we're seeing in our blood work and the GI map.
That's really cool that you're able to see anyone and everyone, because sometimes you're just like, we're out here in Seattle, Washington, and you're out there in Tampa, and you're just like, how do our worlds collide? And that could be really daunting. But also, as you're talking about all this stuff as a working mom, sometimes I'm just like, where do I even start? What do I even do? Because it seems like you peel back one layer when it comes to hormones, infertility, insulin resistance, all of that, and then it shoots off 5 different things that you have to address, and all of it connects. All of it connects. All of it is intertwined into this why you can't get pregnant, or why you have multiple miscarriages, or et cetera, et cetera. So as an expert in this arena, where would you tell our listeners who are just dipping their toes into, like, I might have some infertility issues, I might be dealing with PCOS, I might be dealing, where do you suggest that we start?
Yeah, I would say there are so many good books. Like I mentioned, Dr. Jolene Brighten, Beyond the Pill, Dr. Lara Brighten, pretty much any of her books are good. And then Elisa Vitae has, I think, the fifth vital sign. So
Yeah.
just some of those authors, Google those names, get started reading their books. That is a great place to at least start to understanding this connection between hormones and diet and lifestyle. And that will really, a lot of those books will give you solid advice on where to start. Now, applicably, I would start with that cleaning up your diet. What that would look like is removing a lot of those ultra processed foods. And I would say this is maybe basic information that maybe people have heard. I don't know. These days, I don't know what people have heard. I see all of the spectrum. I see someone, they're still eating McDonald's, and I see people who are like, I'm only eating organic. So I don't really know where people are starting these days.
Yeah.
Almost they're like
Yeah.
nutrition education.
Right.
Even my people who are eating the healthiest still seem to have a very skewed view of food. So what I really say is removing those really ultra processed things and bringing in the whole foods and what that really means to me and how I'll teach you the plate method that I teach most every client is when you're building a hormone healthy meal, what you ideally want it to look like. So you have your plate. About half your plate should be non-starchy veggies. So, your broccoli, your zucchini, your bell peppers, your onion. And we could all dive into like dark leafy greens have folate. These are great for fertility. But when someone's just starting, I'm like, start with veggies that are okay and you decently like. Maybe you grew up on some cooked green beans, that's fine. Start there. And then you can gradually broaden your horizons, but start there. 1/4 of your plate ideally should be a fiber rich carbohydrate. And what that looks like is our whole grains like your quinoa, your brown rice. I'd say white rice is okay, oatmeal, or your fruits. And I'm a fan of pretty much any fruit, or your starchy root vegetables like your sweet potato, your regular potato. Not a lot of people are eating turnips, but I'll throw it in there. And then the other 1/4 of your plate should look like a protein source. So typically an animal source, I really like to say diversify between animals, plants, and then the different types of animals, eggs, fish. And I say whole protein. I'm like, I don't know how to describe this one. Like your unprocessed meats, your ground beef, your ground chicken thighs. Pot roast is amazing. I just rediscovered pot roast in my life. Has been like my big pregnancy craving. I'm like, all I want is pot roast, which is so weird, but I'm like, it's incredible.
Hey, I'm a big
Um,
fan of pot roast.
oh, good. It's so easy.
Yeah.
But trying to not do your chicken nuggets, a ton of like your bacon, those things are okay in moderation. And what I say moderation is, again, I like to really break down definitions and because people say that, well, just eat in moderation. What is that? So I say 80% of your week should be these whole foods, focusing on the plate method. 20% of your week, your chicken nuggets is that protein on your plate. It's only happening 20% of the time. Not something huge, big deal to worry about, right? Because what I also see is people are so scared to have the chicken nugget. They're so scared to eat the bad food. That stress in and of itself is not helpful either. So one of the really big things that we see in nutrition research is the importance of dietary patterns as opposed to this one very specific food is that bad. For example, ice cream. Did you know that there is a study that ice cream can support fertility? You would not think
No.
that. You would not think that. And maybe these people like enjoy life because they eat ice cream more. For example, my clients are like, can I eat ice cream? I'm like, try to do it like 2 nights a week and then have the rest of your day. There's a really big difference between your day being like a bagel, a Starbucks Frappuccino, muffin, and mac and cheese, and then you have ice cream versus your day being like a beautiful breakfast bowl with like eggs, bell peppers, sweet potato, your lunch and dinner being similar to that, and then having ice cream there. You can see how that would be
Yes.
2 completely different dietary patterns, right? So
Yes.
that's why I really try to hone in with my clients because, again, I just see on social media, especially the food fear, and that really bothers me a lot. Really try to focus on what things to add into our diet as opposed to what to remove.
Yeah, well, that food fear then can then lead to really unhealthy relationships with food where I've interviewed guests who have shared with me their struggle with bulimia or anorexia or all of that stuff. And it's like this all comes down to let's not swing the pendulum one way
Mhm.
or the other. It's about balancing what you have and maybe not eating all brown food for the day and then ice cream on top of that.
Yes, exactly. I know. I've been really trying to teach my 18-year-old some like very basic nutrition things. She's still eating like, oh gosh, the regular pancakes for breakfast. I don't even know what that girl eats. Egg pop and Starbucks for lunch. And she's gonna be a hairdresser. And I'm just like, you need to fuel yourself. You're gonna be on your feet all day. These are not really offering you because the issue with ultra processed food, I don't know how you feel about the whole seed oil conversation, but
Mm,
that has been blown up
yes.
really blown up, and I have a really big deep dive post into, like, seed oils, and technically, the research on a human randomized controlled trial of seed oils show that they are not inflammatory. They either actually
Mm.
improve inflammation or they have no effect on inflammation. So, is it the seed oils that's the issue, or is it the food in which seed oil is coming with, which is food, again, the ultra processed food that are devoid of nutrients. They lack fiber. They are high in processed fat. They are just really coming in a package of lots of not nutrient goodness. And so is the issue seed oils or is it the other things in that? Potentially, yes, like it can drive the issue with the balance of omega-3s and omega-6s. But I would really venture to say if someone had a whole foods diet and they were cooking with canola oil, I'd venture to say they would be fine. I really
Huh.
think that it is again, the landscape in which seed oils are. What foods are they in?
Yeah.
Right? You're
Yeah.
not just like doing extra virgin sunflower seed oil, safflower oil on your nice, beautiful green leafy salad. No, you are usually having it again in these packaged processed foods. So again, it's just that conversation of just what do we actually need to focus on? What should your priority be? Should your priority be removing the seed oils or should your priority be adding in the healthy foods?
Yeah.
Would completely change also a lot of people's relationship with food and make them less afraid, in my personal opinion.
Yeah. Yeah. And it's actually really easy to eat healthy, and people think it's really hard. It does take, again, being a full-time working woman and mom and all the other titles that I hold, it is hard to sometimes go, okay, I can easily just go through this drive-through through Chick-fil-A and get this. Or do I come home and grill up a nice piece of salmon and then cook quinoa? And just sometimes you have to do it. But this is not an ad for Home Chef, but my sister got me on Home Chef. And it's just so nice to be able to just whip something up with all that preparation already there for you. And you can be really lenient on what you want to include in your order. So I feel like you
Mhm.
have those resources. People have those resources now that you can do. And I am not a big like meal prep person because I love to, what do I feel like eating today? What I felt like eating yesterday is not what I feel like eating today. So it's hard for me to like meal prep for the whole week kind of stuff. So those like home chef type of resources has been really helpful for my family to just eat better and not just be like, let's go to Chick-fil-A today.
Yeah, and
So
I would say that's so, like, with a really big, I don't know, philosophy, I don't know, belief of mine is the coaching. So, right, you have the high level, like, the labs that we do, coming up with which supplements, those things, but for me, what has been the most impactful and why I structured our program to be a 4-month coaching program
mm,
is because I really love and think it's so important to work with people and their lifestyle and what is works for them. I have clients, they're totally great with meal prepping and I support them. I help them with the recipes for that. I have other clients like yourself where I'm like, hey, you actually might benefit from a meal service or HelloFresh is another one of
yes,
those, right?
yes, yes.
Some people might really benefit from that, and other people, you have to work with them of, like, how I have a whole document of, like, 30-minute or less meals, like,
Mhm.
teaching them and that's why I love the plate method because you can fit so many dietary preferences, and it teaches you, like, what should be on your plate, not just, "Oh, healthy food," and again, a lot of people, I think salad, there's, "Oh, I throw together a salad," and it's like, you don't need to do that. You could have some raw carrots on the side, you could
Yeah.
have then a fruit and 3 eggs. It might not be like
Well,
a perfectly curated meal, but it helps you throw it together fast.
also, like, your spaghetti can be healthy if you put vegetables in it. My son is 4, and so it's like I try to not only use, like, lean meats when I do my spaghetti, but also put, like, spinach in it, and what else do I put? Olives, or just pack it with vegetables, and then he's eating vegetables with spaghetti, but he doesn't know it.
And then what I'll have people do is if you're forming a bowl like that, I still do the plate method, and then I have you mix it up.
Yeah.
Because it also, especially with the metabolic dysfunction, carbohydrates, we have to be mindful with the amount of carbohydrates that we're gonna put in.
Mhm.
So, like spaghetti, right? People are so used to having the whole base of their bowl being spaghetti, and I would say, "Hey, maybe have the base," or again, when you're just build half the plate being veggies, 1/4 protein, then your 1/4 spaghetti, then mix it all up. And
Yeah.
then you're gonna have a way, way better balanced meal. So again, just like you said, it's that nuance of this specific food is not inherently unhealthy. Like sugar is not inherently unhealthy. It's when it's overdone, not in relation to enough fiber, not relation to enough protein, not relation to enough movement. It's
Mm.
so much more nuance to that. And just one of the biggest things that is like my biggest goal, you shared like a lot of your guests come from poor eating backgrounds. And that was saying like I developed, I think it's a clinical diagnosis now, but like orthorexia, like just being obsessed with every single thing that I ate. It had to be clean. It had to be like perfectly refined, sugar, blah, 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 free. And honestly, like when I was the most strict and like, yeah, being the most restrictive, my health was not good. And now I have the most variety, like varied diet. I can eat ice cream here and there. I eat these things here and there, and it's not a big deal because 80 to 90% of the time outweighs that one time I have ice cream. So I have the most food freedom that I've ever felt. But I also think, and again, I could always go on tangents, but I think there are some people that are like food freedom, like you should just be able to eat like whatever you want. I don't know if you've seen like intuitive eating, and it's no, there are these principles, right? And research that certain foods are going, and how I just see food is I can just see what nutrients are in each food. And it's just like those are going to obviously fuel my body so differently than foods that are lacking of those nutrients. So whenever I'm eating, I just say I make informed choices instead of being so like black and white, if that makes any sense.
Yes, absolutely. So, do you think the American diet promotes that type of approach to food?
So do you mean like the current like American guidelines that are out or how Americans are actually eating?
Both.
I did a lot of research on this. So about only 10 to 15% of Americans are actually following the American dietary guidelines. So what Americans are actually eating is not what the government is recommending. Now, do I think that the guidelines could be improved? I do. However, I do think that Americans could be significantly healthier if they just followed the guidelines we already have in place. And I did that research because I was brought into Washington, D.C. a few weeks ago to talk about these things. Like, how can we improve the guidelines? And really, when I was doing this research, I'm like, we can talk till we're blue in the face about the guidelines, but no one is following them. So why spend time to rechange the guidelines if no one's following them? Gosh, I wish I had my notebook of statistics right in front of me, but I want to say about 50% of American calories are coming from ultra processed food, if not more. Obviously, this is very dependent on each household, but majority of calories are coming from ultra processed food, and most Americans are eating over 3,000 calories a day. Again, 50% of that coming from ultra processed foods. That's not in the American guidelines. They do not recommend that. Now, they actually use a similar plate method, but it has like fat, and then whole grains, and then fruit. They don't have a part on the plate for veggies, which I thought was interesting.
That is interesting.
Yeah, and I think that the guidelines can be improved, but they still recommend like less than 25 grams of added sugar, having most of your grains come from whole grains, eat fiber, eat lean sources of meat. I think full fat dairy, based on the research, you should eat full fat dairy over low fat dairy. So I would agree with that of the guidelines. But again, most Americans aren't even doing that. So that's just a question. So those are in my head, right? Those are two different questions, right? What exactly would I prove about the guidelines? But overall, what Americans are typically doing is overeating ultra processed food, overeating in general. And then over the flip of the coin is that then you have people who are just like completely restricted. I would say that's what I see in my clinical practice is like no one is really eating a truly balanced diet and then leaving room for, again, you can have ice cream and it's not going to kill you. So yeah, so I would say those are just like the two different camps, and those are like two different conversations. And that kind of leads to what you were saying though, is that for me, I created 5 points when I was preparing my talk, like 5 points of why Americans aren't following the guidelines. And I'll try to remember them off the bat. But one was definitely our culture, right? It is our culture. I have one of my clients, she works at Hershey's and there's candy bars available, there's donuts available. Like they have a snack bar and it's essentially all ultra processed food and candy. And then our work days are long and they're hard. And it is can you go to pick up something healthy easily?
Yes.
I
That's
have this
so
like
hard.
I have this amazing, it's called Fresh Kitchen in Florida, and they use only extra virgin olive oil. Like I said, I'm not that worried about the seed oils, but it's all good foods, and you create bowls, and their bases are either like greens or whole grains. They have salmon, almond crusted chicken, and then all these veggies. And it has been the biggest blessing to just be like, oh, like we don't feel like cooking tonight. Great, let's just order Fresh Kitchen, and you're not just again, you can't just get like a burger or fries. Like you don't have a lot of options. I think it's the American culture. It's also, I think role modeling has been less like ever since the TV dinners came out, American households have been cooking less. I also believe the statistic that most Americans will eat out at least for dinners 3 to 5 nights a week. So a lot of people aren't learning how to cook. So then they're like, "Great, I can try to eat healthy, but I'm so intimidated by cooking these things. I don't know how to cook it." So
Mhm.
there's that. Social media, people are so confused. So they don't do anything at all. Like, oats are bad? Okay, can't eat oats. I thought that was healthy, but no, that's not healthy. So I know eggs. So I know someone told me that's gonna increase cholesterol, so eggs
Yeah.
are off the okay, whatever, I'm just eating pancakes. So I think there's information overload. I'll stop at those 3 points, but I think that we need to really focus on why people aren't eating healthy,
Mhm.
and that's, really a big culture change, and like I said, why I'm a huge fan of, like, nutrition coaching. We can work with people to understand what their specific barriers are. We can overcome those barriers
Mhm.
versus just shouting at them nutrition guidelines that they're just like they are too overwhelmed to follow.
And I like that you're saying your services cater to the lifestyle that is unique to that individual. There's not this cookie cutter. I mean, there's obviously basic, these are like the bases of what you guys need to know, but let's try to pivot things or tweak things to make sure that you do fit in fruits and vegetables into your lunch. And it's not, oh my gosh, shame on you for not having fruits for lunch. And then now you can't have any ice cream tonight for
Yeah.
dessert. That's not the situation here. The thing is, how do we set a basic understanding of why it's important to have these things and how do we fit that into your life and make it easier for you to incorporate those healthier choices? Last thing I wanted to ask you before we wrap up, and there's so much we can dive into later on, but this is totally scratching the surface. But what would you say to people who are saying it's just too expensive to eat healthy?
Yeah, I that's actually on my list. That was number 5, is that it is too expensive, and I agree with that, and that's where, like I mentioned, I was in Washington, DC. I would really love to see improvements in cost. There is Dr. Mark Hyman, which is, like, one of very well-known person in functional medicine. He said this 10 years ago when I found him, but he was like, "What if we had the cost flipped on its head, that it would cost you more to eat a burger because of the health implications that would have long term
Mhm.
versus healthy food, where it's actually you're going to be less of a burden on the medical system in our country in general if you eat healthy, so incentivizing people in that way." So I agree. Like, I will tell people, and that's where I also, again, individualized coaching. If someone can buy the organic grass fed, I will recommend that, but what I tell people is there's good, better, best, right? And so good is like you can get the conventionally whatever
Mhm.
produce, that's again still going to be way better than Pop Tarts, right?
Yes.
And when you do price it out and take the time, if you are eating out for the majority of your meals, then to just at least again eat basic conventional healthy foods, it will be around the same price, if not cheaper to do. So again, that's where we kind of work with our budget and our cost restraints and say good, better, best. My always opinion is do what you can and let go of the rest, when it comes to those things. Again, I would challenge that it doesn't have to be as expensive as you think. You don't have to buy all organic, all grass. Again,
Mhm.
you can start with just regular conventional, and then what we also talk about is there's also maybe foods to prioritize organic versus not. So for example, for veggies, if you can easily peel like the top skin of it off, or like a fruit like a banana, an avocado, an onion, where you peel back that thick layer, buy that conventional 100%. If something's going to be directly sprayed with the pesticide, so your dark leafy greens, your berries, ideally buy that organic and frozen. You could buy it frozen and it's significantly cheaper, more cost effective.
Yeah.
I use Costco for a lot of my organic meats. Obviously, it's a lot when you're like Costco once a month, but then after that, we have all of our meats for the whole month and they're the organic grass fed, whatever ones.
Mhm.
Yeah, I think there are hacks and we talk about that working together. But I think also too, there definitely is a really big issue in the healthcare model. I mean, I've
Yes.
seen this all over my social media. I don't take insurance. I accept HSA or FSA cards, but I have to work outside the insurance model, and even more doctors. So I've seen the philosophy, because everyone knows, I feel like everyone knows there needs to be a reform in insurance. And a lot of doctors themselves are really saying the only way that we'll get out of it is if doctors themselves start getting out of the insurance system, and then it will make insurance change. And
Yes.
so I agree that there are just bigger issues, and so I just empathize with that and say, so for I also say for our program, I am like very morally set on the price that it's at. And I know programs that are 2 to 3 times the price of our program that are doing the exact same thing, if not less one-on-one support. It's like we're trying to obviously reimburse my team, myself, the best that we can, but also keep that in mind.
Right.
I don't know. I don't have a great answer, honestly, if I'm super transparent and honest. I wish it was easier and better. And hopefully the people that we have in office, as you can tell, I disagree with some of the things that they are doing, but hopefully their ears are open to what we actually need change in to see better improvements in America's health, if that makes sense.
The typical American diet, it's a systemic issue. It's not just like, oh, eat organic and your life will start. It's a start. It's a great start. But when, like you said, the medical system has become an industry to keep you in some ways trapped in that vicious cycle of unhealthiness because they make money off of that addictive behavior, or it's much more profitable when someone is continuously having to deal with their diabetes, them actually finding a healthy balance and potentially not being diabetic anymore. There's a repeat customer when a hospital system doesn't have to teach you all these good things to get you off of that diabetic medicine.
And they've discontinued programs because they were losing money.
Yeah.
They discontinued nutrition programs because it was losing the hospital money.
Yeah.
That's so bad. So bad. And I'll say that's also the issue with capitalism. Like my business is like the epitome of capitalism. Like I've been able to build this business from scratch and it's been an incredible thing in my life. But then you see the bad sides of it too. I would say there's no solutions, only trade-offs. And maybe that's an unpopular thing, but I think there's probably not going to ever be a perfect system per se. But when the health of our country is at stake, obviously there needs to be change and there needs to be reform, and that needs to be priority over money. Hopefully we can get people on our side in that.
I think, there's just, I mean, on social media can be used very powerfully. And I've just been seeing much more people talk about, do we want to be a part of the problem? And continuously, there's just been a lot of crap on the American diet. And I'm just constantly like, yes, let's keep talking about that.
I just pulled up Instagram and I just said, breaking, Starbucks to remove canola oil from the US menu. That's not going to do SIT for chronic obesity and issues. That's what I'm saying. I'm like, removing seed oils and dyes is not going to solve the obesity epidemic.
Like maybe Starbucks, how about having smaller sizes versus like the grande that puts you in a freaking...
your 4 pumps of sugar from your frappuccino.
Yes.
That's going to make a way big difference.
Sometimes I see people walking out and their cup is like this. And I'm like, there goes your whole day.
And that's my question. Like, again, we could talk about this for hours, but I'm just like, whose accountability is that? Is it on Starbucks to offer that, or the person to know that's not great? I don't know. And that's why I will say my opinion is I just think we need more coaches. Again, we need more nutrition coaching because you don't need, and we have nutritionists and dietitians, and doctors are not be recommending to those people. But I do think nurse coaches, health coaches, I do think that's the future of medicine, because we need to sit down at the table with people and say, you know what to do. Why aren't you doing it? And how can we help you overcome that? Because most people know that Starbucks Frappuccino is healthy. I don't think you would say, like, if you were like pointing out to someone like, that's probably not great for you. I don't think they would be shocked. I just really don't think so. Most people know fruits and veggies are good. Yeah. Why are people not doing them?
Yeah.
That's what to have those personal conversations, those one-on-one conversations. So that's what I think. I just think, again, like I said, we have these US dietary guidelines that less than 10% of Americans are following. So what is that disconnect? And that's where we need to plug in instead of, again, the seed oils, the blah, blah, blah. I just don't think that's going to do anything to solve the crisis that we're seeing.
Yeah. Well, it makes a lot of sense to me. And I'm definitely not perfect at any of this stuff, but it's really wonderful to know that you are a resource out there for a lot of us. We're going to put your website on this podcast, and hopefully people give it a listen and just start thinking about what they put on their plate every day and how just small intentional changes can really help kind of curve certain diagnoses, or just fertility is just a huge thing right now and how it's connected to our diet and our hormones and our nutrition. And I just want to keep talking about it because not only is it a personal thing for me, but we are seeing it in our patient population every day, wondering what they can do to change things in their lives. And it sounds like it's doable and it's good. And there are folks like you out there who can walk alongside them and say, you're not alone in this. It doesn't have to be lonely. It doesn't have to be costly. It doesn't have to be overwhelming. But it's also an investment in long-term health, right? Don't be scared about this initial price tag because there's a lot of things we can adjust in our lives to make resources like you work. And 10 years down the road, when you're healthy and thriving and just being in a season of good nutritional health, that's worth it to invest in it now. So thank you for what you do.
Thank you. That's what I say. I just say always, I don't take the cost lightly. I know it's an investment, but my goal at the end of the 4 months is that you don't need me or my team. Of course, we'll give you that resource if you do want to need us.
Yeah.
But ideally, what we teach you, and you had that time of coaching, and that's what we hear so many times from our clients, and that just is obviously is my heart of my work, is like they message me 2 years later and they're like, I'm still doing what you told me. And I'm like, oh, because there's people that go to functional medicine people and are like, that was way too restrictive and I just couldn't even keep up with that. And that is so sad because maybe that advice was good, but if you can't keep up with it, then there's almost no point in my personal opinion. So to hear that from clients is like the biggest thing that I could hear is to feel confident moving forward and to be able to continue with it and it feel maintainable. I always ask that. I'm like, do you feel like you can maintain what we have worked on? And their answer is 99.9% of the time, yes. So that's, again, just like you said, I do view it as an investment that you will use long term. We do have resources that you can we have a whole library of educational modules that you do get lifetime access to. So, but yeah, I'm just, as you can tell, I love to talk about this stuff. It's my heart, my goal. It's my first baby, truly.
Yeah.
I've been obsessed with nutrition and hormones before my business, before my actual babies. So it's just something that I could talk about all day long, forevermore. And I just clearly have a passion and hopefully I am using it well.
Yes, you are. So thank you so much for taking the time to introduce yourself and introduce the services that you guys provide. It is obviously very needed. And like I said, this is just the tip of the iceberg kind of conversation because there's so many deep dives that we can go into. Just talking about, I haven't even asked you about gums in our foods. That's like a whole nother freaking can of worms that we will spare our listeners right now. But because I really want to pick your brain about gums. That's like a whole nother vibe. So thank you so much for your time.
Thank you so much for having me. And if you need a part 2 or if your listeners have very specific requests, then maybe they put in that. So
yes, absolutely. Absolutely. All right. Well, thank you listeners for tuning in. Thank you, Jeannie, and enjoy Tampa because we're all very jealous from Washington. Thank you. For more information about 3W, please visit our website at 3wmedical.org. That's the number 3, the letter W, medical.org. From there, you can learn more information about the services we provide, book an appointment, or make a donation if you'd like to support our mission. You can also call our office at 206-588-0311. That's 206-588-0311. If you like this episode, please share it with others and consider subscribing on your favorite podcast platform so you never miss an episode. Thank you so much for listening, and until next time, stay healthy and be well.